Good evening. I'm Zach Rowe, the HIV Programs Director for One Community Health, and I'd like to welcome you to our virtual World AIDS Day event. Thank you for joining us today. World AIDS Day is held on December 1st each year for people worldwide to unite in the fight against HIV, show support for people living with HIV, and to commemorate people who have died from AIDS-related complications. World AIDS Day was the first ever Global Health Day, initially held in 1988. This year marks the 32nd anniversary of its observance. Across the world, more than 35 million people have died of AIDS-related complications since it was first identified in 1984. In Sacramento County, over 4,200 people are currently living with HIV. Men who have sex with men are burdened with 70% of new infections. Black and Latino men experience the highest rates, despite less risky sexual behaviors. Trans women and men are also at substantial risk due to the compounded marginalization they experience by our society. In the US today, someone is diagnosed with HIV every 14 minutes. To date, it is one of the most destructive pandemics in history. At home and abroad, the fight against HIV continues. While the early years of the epidemic were marked by loss and despair, newer scientific advances in HIV treatment allow someone living with the virus to maintain an undetectable viral load, live a long, healthy life, and prevent transmission to partners and loved ones. People living with HIV who take medication can reach an undetectable viral load. People who are undetectable cannot sexually transmit HIV to an HIV-negative partner. We call this U equals U, or undetectable equals untransmittable. U equals U and new prevention methods like PrEP, a once-daily pill that is 99% effective at preventing HIV, means that we can see an end to the HIV epidemic, both in Sacramento and across the country. Yet despite this, around 200 people are diagnosed with HIV each year in Sacramento County. Stigma and discrimination impair our response, while social and structural barriers prevent some people living with HIV from reaching viral suppression. The impact of treatment underscores the importance of expanding medication and medical care access. For those at risk of HIV, too many are still unaware of PrEP or how to access it without any cost. We cannot overcome existing health inequities without addressing the barriers to comprehensive, affirming medical care. One Community Health is committed to addressing these barriers and supporting our community's most impacted populations. We are currently writing a strategic plan to improve and expand our HIV services to our community. Look for more information in 2021. World AIDS Day is a crucial reminder that the HIV epidemic continues to wage war on our communities. Today we acknowledge the contribution of activists, public health workers, healthcare providers, researchers, victims, and survivors in the fight to end HIV. Today you will hear from other community stakeholders involved in the regional response. You will also hear more about the state and local strategies to end the epidemic by 2030. If you have a story to share, I encourage you to stop by our clinic in Midtown to contribute to our World AIDS Day tree. The tree will gather leaves for the entire month of December, serving as a symbol to our staff and our community of the legacy and impact of HIV. If you cannot travel at this time, send us an email or message us on social media, and we will write a leaf for you. We hope that you join our community in honoring those lost and communing with those still committed to the fight. Thank you.
Hi everyone. On this 33rd Annual World AIDS Day, I'm grateful we can join together virtually to raise awareness about the impact of HIV and AIDS on individuals and communities around the world. Every year, on December 1st, we come together to renew our commitment to the fight against HIV/AIDS. Today, we unite worldwide to show our support for people living with HIV and to remember those who we have lost from AIDS-related complications. Over the past decades, we have made tremendous strides in HIV prevention, education, and treatment, and have seen successes in our efforts to reduce the global burden of the disease. But we still have much more work to do. To finally end the HIV epidemic, we must continue to leverage critical tools that can improve our prevention and outbreak response efforts. We must lend our support to innovations in testing, treatment, and care for persons living with HIV, and address the widening gender, racial, social, and economic inequalities of the AIDS epidemic and the COVID pandemic by working to ensure equitable access to care, both at home and abroad. Today, we celebrate the strength of our communities and the dedication of our local and global partners to stop HIV stigma and promote prevention and care. In the midst of a global pandemic, we have a shared responsibility to protect at risk groups from bearing the burden of the disease. I ask you all to take time to reflect on how you can make an impact, whether small or big, to continue the fight every day, to come together to end the HIV epidemic. Thank you all so much for your work, and please stay safe.
Hello. It's a privilege for the California Department of Public Health Office of AIDS to join you in this World AIDS Day recognition here in 2020. This year's World AIDS Day theme is resilience. And we've seen a lot of resilience throughout the years of people living with HIV, people staying HIV negative throughout this pandemic of ours, HIV. And if any year needed resilience, 2020 is the year. So I'd like to share with you some of the most recent information and how we are working towards ending the epidemics. My name's Kevin Sitter. I'm the Ending the Epidemics Program Manager at the Office of AIDS. My goal is to have no more HIV infections, 0 HIV infections, 0 hepatitis C infections. Both of them are manageable. Hepatitis C is curable. And we need to make a U-turn in our STDs, that they've been on a skyrocketing rate going up, and we really need to change that to a descending trajectory. That's my goal over the next 5 years. And let me show you what needs to be done to have that happen. So as I said, I'm working with the California Department of Public Health. We are within the Center for Infectious Diseases. And what's significant is that this newest pandemic, COVID-19, the Center for Infectious Diseases is the landing spot for such a pandemic. And so all hands on deck. We've had a lot of our staff from the Office of AIDS transfer over to assist in responding to COVID-19. We are privileged to respond to this pandemic because of the knowledge we've gained from our earlier pandemic of HIV/AIDS. Learning about genomes and how to where the virus attaches to T cells in its replication system. These were all new and novel when in the time of AIDS and HIV. And those tools that we learned then are being applied now. And so the benefits in COVID-19 is we have a much faster response with vaccines being developed, with medications being used and trials being done in a faster way. Not an unsafe way, but a faster way. But let's go back to our epidemic. We still have some significant achievements needed to reduce new infections, despite all the significant achievements we've done to date. Viral suppression and the use of PrEP. Those are the two achievements that are necessary to end this epidemic of HIV. Viral suppression is when the amount of viron or virus in the bloodstream of persons living with HIV is so low that it really can't be detected. The benefits include the fact that the body isn't being stressed by HIV, and so a person lives a much healthier life. But in addition, they can't transmit HIV to others. And so to get to 0, the benefits of having all people living with HIV healthy and unable to transmit will help us reduce new infections. For those people at risk of becoming infected, PrEP has been shown to be a very effective medication to avoid HIV infection. On the concept of birth control is something that needs to be taken daily, but in taking it, the medication that's in the body can knock out HIV before it really settles in. And so we'll be able to use PrEP to avoid new infections of people at risk, viral suppression to avoid transmissions to others, and that will get us to zero. Now, viral suppression means that we have to know people are infected as early as possible. The rapid linkage to HIV care and to ART, um, HIV medications, is critical. We no longer wait for a T cell count to get to a certain period or for any other conditions before we start meds. Once you learn you're living with HIV, start the meds. It gives you the best long-term outcome. It will reduce your viral suppression within 6 months. And so the benefits to you as an individual living with HIV, especially if newly diagnosed, are wonderful. But you have to also stay in care. And I'm going to show you a little about what happens when people aren't in care. And we need to recognize that there are some people, despite being with their doctors, still can't get virally suppressed. Could be depression, could be a chaotic life, could be that they don't like medicines. And so we need to help support and troubleshoot with people who the meds will reduce the virus, but in certain situations when people don't take the meds regularly, that's going to be a challenge. Now, PrEP, on the other hand, we still need to teach the community more about PrEP. That some people think it's just a gay men's medicine, but it's not. We also have to recognize that to consistently talk about PrEP when people test HIV negative. There was a reason why they sought an HIV test out. And if they're at risk of becoming HIV infected, it's important for them to be able to give an option after their HIV negative result to keep that negative result. And PrEP is a great option for that. We need to be able to get PrEP on demand. We can't make an appointment with a doctor, go in and have labs, wait a week or 2 weeks before the labs come back, and then go into the doctor and finally get our script to get to the pharmacy to get the PrEP. When you're ready for PrEP, you should be handed PrEP. We have found that it's okay to start the medicine at the same time as you do the labs. And if the labs came back with something that wasn't quite right, you just stop PrEP. It's not a long-term harmful situation if, say, your kidney function isn't as strong as it should be for taking PrEP. And so PrEP on demand is a way to immediately start people on the way, because we see that a lot of people drop out and say, why bother? Or I've missed the appointment, I'm just going to skip it. So PrEP on demand is one of the strategies we need to look at. And then for those who were on PrEP, but they stopped PrEP, but they haven't talked to their doctor, it's really important for us to remind them that talking to a doctor when you're ready to stop PrEP is critical, because you don't just immediately stop it. You want to be able to work with a doctor to take it as long as necessary before the reduction of the medication load in your body. So you are going to be the ones to end the epidemic. I'm going to help, but I can't do it alone. The Office of AIDS can't do it alone. It is you who will end this HIV epidemic. So we talked about viral suppression and that people need to know they're infected. We need to get them into care, keep them in care, and get them virally suppressed. Here's what you can do. If you've never tested, test. The CDC asks everyone from the ages of 13 to 64 to have at least one HIV test in their lifetime. And if you've had ongoing risk or you have new exposure potential, test again. Do you have friends who have never tested, or they might need to update their HIV status? Support them and help them to get a test. Go with them if you need to. We need to know that people living with HIV who are not in medical care need medical care. And so if you hear someone say, oh, I haven't seen my doctor in a couple of years, help them get in to see their doctor. At least once a year is important for maintaining your relationship, keep the medication going. And again, you'll see that when you go out of care for more than a year, it's not helpful for viral suppression. Do you know people that aren't on HIV medications despite being living with HIV? Now's the time to start. Remember, the newest information says start people on HIV medication as soon as they learn that they're infected. And so if there are people that aren't on medication or they've stopped taking their medications, we want to talk to them about the benefits of starting it again. Do you know people who are not virally suppressed despite them being on medicines and at the doctor? You might want to ask them, is there anything that gets in the way of taking your meds regularly? Is there anything I can do to help you? I had a friend who it was an animosity. The pills were his enemy because they kept reminding him he was sick. So I tried to help him, and we wound up taking a cigar box and shells and glitter and all kinds of things. And we made a treasure box to put his HIV medications in to help change that from a foe to something treasured to help him live and keep his health going. Again, undetectable equals untransmittable. Help teach this because people still don't quite get this right. Undetectable, again, means that there's so little virus in your bloodstream that they can't really count it very well, and that's viral suppression. And when you're virally suppressed, you cannot transmit it to others. This has been shown in multiple research studies with gay men, with straight men, with women in Africa, in South America, in the United States, and industrialized Europe. And so undetectable equals untransmittable. And that's where I get a lot of relief. Being a man living with HIV, as long as I'm virally suppressed, I know I'm not going to infect anyone else. And that brings a sense of relief to me. So you are going to end the epidemic. And again, on the other side is the PrEP. We learned that you have to inform people about it. We need to talk about it, have it on demand. So what can you do? Get the facts about PrEP, tell other people about it. Remember, PrEP is for women, for trans folk, for gay men, for straight men, for people who inject drugs. And so everyone who is at risk of becoming HIV infected deserves to have this choice as a preventative option. Do you know people at risk who might have multiple partners, they bareback? Encourage them to think about PrEP. It's simpler than condoms in a lot of respects. To use condoms is really important even when you're on PrEP because of this STD thing going on. But at the same time, if we're talking about HIV prevention, PrEP is the way to go for a strong effectiveness. Does your healthcare provider offer PrEP? Ask them. And if they don't, encourage them to be a PrEP provider. It's simple to manage. Any general practitioner can do it. It doesn't take a specialty HIV doctor to prescribe and monitor people on PrEP. And do you know people on PrEP? Could you thank them and encourage them for doing safe choices, for taking care of their body? We need to encourage people on PrEP, going away from the slut shaming that was the start of PrEP to this empowerment of using an effective prevention tool. Here's what I wanted to talk about regarding new infections. Sorry, I'm trying to move my photo of down so I can't see that. So this is about newly infected people. And in 2018, after 1 month, 79%, 8 out of 10 people almost, were in care within 1 month. That's super. We really appreciate that. And after 6 months, 64% of them were virally suppressed. Now, in that time period between 1 month and 6 months, an additional 10% were linked to care. But you don't see a 10% gain in the viral suppression in the 12-month compared to the 6-month. So what it's teaching us is the sooner as you start medication and the sooner you start going to an HIV doctor, the more likely it is you're going to be able to successfully become HIV virally suppressed. Delay doctoring, delay your viral suppression. Now, another way we can look at this is everyone in California living with HIV. The California viral suppression rate in 2018 was 64.2%, but I've got 3 bars here that tell me different percentages. Let's start in the middle, this 90% viral suppression rate. Who is this? These are individuals living with HIV who had at least 1 medical visit in the last 12 months with their HIV doctor. Just 1. If you're healthy and everything's going well, you don't need to be in there every 3 months. But being engaged with your medical care brings you viral suppression at a much higher rate. It's only 64% for those people who did not see a doctor in the last 12 months, which is why we want to listen for people who say, oh, I've seen my doctor. When was the last time? A couple of years ago. No, we want to do it annually. And this is the benefit of that. When we add the people that are undiagnosed, remember, we've got a set of people who are infected and walking around with HIV, but they don't know it. And we need to help them learn their HIV status. We have to reach out to them who haven't taken the test because the benefits of knowing you're HIV infected is important. I've given several hundred HIV positive test results, and I've never given bad news because when you know you're living with HIV, you have the ability to respond to it. It's when you don't know you're living with HIV and you wind up getting sick and in the emergency room, that's a harder road to toe. So let's get everyone identified when they're HIV infected. Here's the PrEP picture. Our goal was to have 60,000 people on PrEP by 2021. In 2018, and remember we have a delay because of how long the data takes to work with, 27,000 people were on, and that's pretty good since we started with 11,000, so more than a doubling in 4 years time. But actually, we should have been doing it in a steeper curve. And so what's it going to take? Because right now, we will not reach that 60,000 mark if we stay on the same path. So how do we move the path over here? This is what the Office of AIDS is doing. We've developed a PrEP assistance program. Anyone with 500% of poverty or less, and that's about $62,000 a year for a single person, can get assistance to work with, to get their HIV PrEP medication, the PrEP doctor visits, and the PrEP clinical visits. The PrEP assistance program also covers hepatitis B vaccine. It covers STD screening and treatment if you have an STD. So the PrEP assistance program is a holistic sexual health support program. We also have a telehealth provider. This is way before COVID. We put in a telehealth provider for those places where there is no doctor that's willing to give PrEP, often in the rural areas, but there's also some places in urban areas where just the doctors are saying, I'm not going to enable those people to have unsafe sex. PrEP is a wonderful thing to take without judgment. And so we have a telehealth option for people. We've developed a whole team within the ADAP unit that's a PrEP dedicated team. They'll be working on marketing, they'll be working on straightening out bugs and challenges. They'll be the advocates and the fix-its when problems arise. A lot of the ADAP enrollment workers have been trained now to be PrEP enrollment workers. And this allows the expansion of PrEP enrollment to as many sites as ADAP enrollment workers are. And it also, when you're living with an HIV positive, HIV negative couple, it's really cool if you can share the same worker. I'm going for my HIV and they're going for their PrEP, and we both get to see the same person. And lastly, we've got navigation programs, PrEP navigation programs to assist people who want to be on PrEP, but they don't quite know how, or they need to get insurance, or the doctor told them they wouldn't give it to them. The navigators can help with that out in the field versus the PrEP team that's in our office. So that's viral suppression and PrEP. Thank you. It's very simple. Oh, wait a minute. It's not that simple. What gets in the way of viral suppression and PrEP? The challenges include the other STDs, stigma, 30 years later, stigma, the different impact of HIV in different communities, social determinants of health, those elements around us that can provide us healthy living or challenge us, food deserts, not having clean water, living close to factories. Those things we can't control all the time, and they do impact our health. Then there's the practical issues like transportation, childcare, accessible hours for those who work 9 to 5, and the doctor is working 9 to 5, and you can't take time off. We need to have affordable insurance, which ADAP can help people with. We need affordable medicine, which ADAP helps with. We need to work with medical mistrust. We have a long legacy of doctors not doing it right. We have here and now doctors who are not respectful to people who are gay or lesbian, who won't treat transgender people, who tell people, just take this pill and I'm not going to talk to you why. So we need to have stronger rapport with good doctors working with ourselves. That's the insensitive provider piece as well. And then our mental health and our substance abuse can often get in the way of our taking meds or taking PrEP and need to be attended to as well. This is why it's not so simple to get everyone virally suppressed and on PrEP. I do want to stop and recognize we're 34 years into the epidemic now. I've been working in it since 1985. I consider the old epidemic and the new epidemic. Originally, we didn't even know the origins of this thing that we didn't have a name for over a year. And then AIDS, and we didn't know why it was AIDS or how it caused. And then we discovered it was HIV. Our transmission points were uncertain, our origins were uncertain. There was limited treatment with inadequate effectiveness and significant side effects. There was significant disabling medical progression. So people went on disability and they could no longer work or do activities of daily living well. And there's a very high death rate in the beginning. But now we understand the disease, we know its origins, we know the replication of HIV with the T cells. And we also know the modes of transmission, which were the ones we suspected all along. So there's been no new discovery of another way that HIV is passed on. And that's really impressive and keeps us on our track of safety. Our medications now are highly effective with minimal side effects. This is a chronic manageable disease now with fewer disabling conditions. The life expectancy of people living with HIV now is getting closer and closer to those people not living with HIV. And so we see much less death. This is what World AIDS Day is meant to appreciate. This is what Sacramento County Public Health is working with the community on. This is what the community coalition is working towards as they promote sexual health broader than HIV, broader than STDs, but to recognize if we respect and celebrate sexual health, we're going to go much farther in ending the epidemics. So the challenges are still with us. The challenges were in the beginning. Stigma was so bad that we separated HIV from other STDs. So you went to a different place for testing for HIV. You didn't go to your doctor because of insurance companies would find out. We can now bring them back together. You should never be offered an HIV test without STD testing and HCV testing. You should never be offered STD testing without an HIV test and HCV test. And so let's bring this family of STDs, of infectious diseases, together. And we also have to remember that it's not just sex. Injecting drug can be a risk for transmitting hepatitis C and HIV. And so our harm reduction, syringe exchanges, alternatives to injection, use of medication-assisted treatment, all of these tools are available to us, but it's been a problem over the 34 years that is still with us and deserves to be treated. Our resilience says that we can overcome these things and we can work towards better solutions. And this is how you can do that. You can use PrEP, condoms, syringe exchanges, and other harm reduction actions to avoid STDs. And you can test regularly for HIV, STDs, and HCV if you're HIV negative. You can tell others about HIV and that it's not a reflection of one's character. We've got to get rid of this shame and this judgment. Denial and avoidance, often caused by shame, stop when respect is given to people living with HIV, when we recognize that they are just like us and that we admire them for taking the medications and for living their lives with HIV, or if they're not living with HIV, we want to admire the people who are using risk reduction to be able to avoid becoming HIV infection. Black Lives Matter, and this year has shown that more than ever. People of color matter. In California, Black and Latinos are the highest populations of new infections, amongst heterosexuals and amongst women, and amongst young gay men. Women matter. We don't always address women with HIV as well as we should. We don't just take the cookie cutter from gay men's treatment and say, here, women, come on into the gay club. The women's needs are different. Oftentimes they're parents, They might be single parents. And so we have to address women and their needs as we work towards prevention and care. People who use drugs matter. If doctors are saying, I won't treat you until you stop drug use, that's unfair, it's disrespectful, and we always know that there's no right door to begin. When you can start treatment with people and support them, even if they're using drugs, you're going to have better outcomes. So you can advocate for more resources directed to those impacted by HIV and, excuse me, to recognize in this new epidemic, we're talking people of color, we're talking women, we're talking young gay men. Participate in planning councils and go on to advisory boards. Speak your voice, share your story, and ensure that resources are prioritized not only to say we need more transportation before we have dog walking. I'm so sorry. But we also need to be able to show for whom we need to get these resources to fastest. And by advocating for those who are in a disparity, having more impact of HIV, STDs, and hepatitis C, we can bring us back to a getting to zero altogether. Now is the time for the real thank you. I want to thank you and recognize all people who have lived with HIV and all people who died from AIDS. They've taught us a lot. They give us wonderful memories. They also give us a part of our heart that is missing or broken or bruised. And we need to recognize that on World AIDS Day. For all of you living with HIV now, thank you for helping to end the epidemic. Go for viral suppression. For those of you who remain HIV negative, thank you. You're helping us get to zero. We have to recognize all the scientists, medical providers, nursing assistants, case managers, navigators, enrollment workers, and other HIV professionals. They are helping to end the epidemic. For all the lovers and the families who have lost someone to AIDS or are nurturing people living with HIV, thank you. You're ending the epidemic. And for those people that were not acknowledged here, we want to make sure that anyone who is missed, I want to recognize and thank you. Happy World AIDS Day.